Okay, Dr. Lucia Benzoni, thank you very much for joining us right now to talk more about all of this. We appreciate your help.
Thank you for having me.
Let me ask you first, what is this new complication that parents should be watching out for? What's it called?
It's called the multi-system inflammatory syndrome in children. We call it MIS-C. And it's a complication, usually it's after the child has had COVID-19, usually undetected COVID-19. And they develop a high fever, and then they may have a rash, and belly pain, vomiting, and diarrhea are very, very common with this also.
Have you seen cases here, doctor, in Connecticut of this so far?
There have been 11 to 20 cases in Connecticut, and I give that kind of wide range because of the fact that you can't always confirm it. There's no definitive test. You know, there's not one test. It's a constellation of symptoms and tests that make the diagnosis.
How serious can this be for children?
Very, very serious. Out of 342 children in America that have developed this, then 6 of them have died. So that's a 1.7% death rate with this multi-system inflammatory in children.
Is there a certain age range where people should be concerned specifically? Are we talking children and also teenagers?
Yes, the median age is 10 years old, but it's defined as anyone less than 21 who develops these symptoms. So it's a wide range. We're seeing the average age, though, anyway, as I said, is 8 to 10 years old. If your child has a fever for a couple of days, doesn't seem quite right, has belly pain, bring them into your doctor. The other thing they can get is a rash, and they can also get what we call a bulbar conjunctivitis, so red eyes, chapped looking lips. They're cranky. They don't feel good.
I was going to say, you'll probably know that they don't feel well. That's for sure. Is there anything parents should do specifically before school resumes and their kids go back to school?
I don't think there's anything specifically that you can do to prevent this. It's just preventing the spread of coronavirus is the most important thing. Children, when they acquire coronavirus, the initial coronavirus, the active coronavirus, they don't really usually have very many symptoms. They don't have the cough. They may not have the other symptoms that adults have. So that makes them, they are not as big of a spreader as adults because they're not coughing and putting forth all those germs, but they are still acquiring the virus, and then the virus is still making the body react in this super revved up response is what this syndrome is. It's a revved up inflammatory response, and that's reflected. The blood test that we get for that reflects that.
Certainly seems like the bottom line here is that we should do whatever we can as individuals and with our family to control the spread of the virus.
Yes, and I think Connecticut's done a really good job. We should pat ourselves on the back.
Okay, doctor, that was great. Thank you. I appreciate your time this afternoon. That was all we needed.
Thank you very much.
Have a good weekend.
You too.
Bye-bye.